Perform a scene survey and make sure everyone is safe. Ask what happened to learn the history of the incident. Identify yourself as a first aider and offer assistance. Make the casualty comfortable and perform a primary survey. Airway and breathing are easy to check by asking where it hurts, but check for shock by checking the skin condition and temperature, and do a rapid body survey to ensure there are no other serious injuries. The casualty will support and immobilize their injury. Expose the injury and examine the wound. An open fracture may show bleeding and exposed bone, swelling, and an abnormal shape to the bone. Compare the area to the uninjured leg. Is there tenderness at the site and pain when the foot is moved? When a fracture is suspected, the casualty requires medical attention. If an ambulance is coming, provide ongoing care. The casualty will support and immobilize their injury. If you must move the casualty, then the injury must be immobilized to prevent further injury. First aiders should consider transporting a casualty only if the injury is not life-threatening, when the first aider is a family member, transportation is not a risk for the casualty and the first aider, and medical help is delayed or cannot be reached. Perform a modified secondary survey. Take a sample history and record a baseline set of vitals. When a leg fracture is the casualty's only complaint, and when other injuries are not suspected, examine the leg from top to bottom to determine the fracture site. Check the distal circulation by comparing the temperature and color of the toes on the injured side with the uninjured side. Protect protruding bone ends with bulky protective paddings and secure in place with a bandage. Apply the pads on either side of the fracture site. The pads should be bulky enough to protect the protruding bone ends. They can be held in place with tape until the bandage can be applied if the first aider is alone. The bandage should be tight enough to apply even pressure on the paddings, but make sure that the dressings do not apply pressure on bone ends and are not so tight as to cut off circulation. Slide bandages under the casualty using the natural hollows of the body. Place padding on the inside of the injured leg. Tie off bandages starting at the stable end, thigh, and work toward the feet. Use a figure 8 bandage at the feet. Compare the temperature of the foot on the injured side with the uninjured side. Check circulation often. If the upper leg swells, circulation may become impaired. If splints are available, place padded splints along the leg from the top of the thigh to the foot. Give ongoing casualty care until handover to medical help. Repeat the vital sign check every 5 minutes and then every 15 minutes if they are stable.